Recently, we heard Elder Affairs Minister Kirk Humphrey sound the alarm about elderly people being abandoned at the Harrison Point Isolation Facility. This is a new and disturbing development, but officials at the Queen Elizabeth Hospital say they're seeing a related situation that is equally as troublesome. It's the increasing number of those labelled as the young for care, or people between 46 and 64 who are being left at the Martindales Road facility. In fact, there are 8 such people currently in hospital.
Most of these became patients as a result of debilitating accidents, injuries on the job, illness. So you found that over the years you are getting an increase in these as persons are more exposed to vehicular accidents and so forth.
Senior medical social worker Michelle Webb-Burke puts the problem, at least for the QEH, into perspective.
Because the legislation would not have had that criteria included, this presents a further challenge to the facility. There's an elderly legislation for geriatric facility, and that is managed mostly by the geriatric hospital and Ministry of Health. Because the legislation speaks to 65 and over as the criteria for admission to those facilities, then the young for care are not covered in that legislation at this time.
Now, Chief Operations Officer Dr. Christine Greenidge says the number of people abandoned at the QEH increased incrementally between 2020 to 2021, but jumped by about 40% between 2021 and May this year. And this is among both the young for care and the old for care, mostly fed by the NCD crisis.
When we harbor around 30 to 40 of these patients in our facility, we are really looking at a situation where a typical ward that can house up to 24 patients, this is equivalent to a ward and a half that no longer can be occupied for acute care because we're housing elder for care and young for care. And so it's a bigger national conversation, I think.
Both women say the evidence of these full beds is seen in the hospital's accident and emergency department, contributing to the long wait times there. People who have been treated cannot be transferred to the wards, making it difficult for doctors to see those who are waiting. Lisa Brome, CBC News.